This one bacteria could be crawling on self-checkout screens, and you'll never look at them the same way. By some estimates, as many as 38% of checkout lanes in chain grocery stores in the United States are self-checkouts, as reported by Grocery Dive. However, a 2021 survey found that nearly 67% of shoppers have experienced a failed checkout process at a self-checkout. It turns out that self-checkouts may be failing in more than one way.
We're completely self-checkout now. Much faster, much more efficient. I think you'll like it.
So the price is going to be lower because I'm doing all the work now?
Health experts are now advising that shoppers wash their hands after contact with self-service checkouts due to the rather grotesque results of a recent study via Study Finds. As reported by the New York Post, researchers from the Liverpool School of Tropical Medicine took samples of everyday items that humans typically come into contact with and probed them for bacteria. The results from the laboratory found that self-checkout stations not only contain 5 types of disease-causing bacteria, but one of them, Enterococcus, is commonly present in human feces.
Should we wash our hands?
No.
When it comes to matters of the fecal type being in our environment, you might be surprised to learn that we're completely inundated. According to Health E-News, fecal matter can be found in beards, cell phones, and even your toothbrush. However, when you practice basic hygiene like washing your hands, the odds of getting sick are rather low. In a microscopic world so tiny that our limited perception couldn't possibly see it, bacteria live on every surface and can be found anywhere that you look. According to the Australian Academy of Science, scientists can't see these microorganisms unless they grow them to a large enough number to be visible. Bacteria lurk in the shadows and can contribute to a number of diseases like food poisoning, urinary tract infections, and strep throat. Dr. Adam Roberts, a microbiology expert who completed the swab results in the groundbreaking study, explained that when someone goes to the bathroom and doesn't wash their hands, these bacteria can travel to other places and infect other people. For those of us who are even remotely germophobic, this could sound like the stuff of nightmares. In addition to fecal matter, self-checkouts could contain other disease-causing bacteria. In fact, out of all samples taken throughout the study, one of the highest bacterial loads was found in the self-checkout sample, according to Dr. Roberts. E. coli in particular was found on almost all the surfaces examined in the study, which also included escalator handrails and computer keyboards. These results may not be all that surprising to you. After all, tons of people touch the checkout screen at self-checkout stations every day, creating the perfect breeding ground for bacteria. Much of the bacteria found on touchscreens are also very contagious, according to Healthline. Practicing proper hygiene is undeniably one of the best ways to prevent the spread of bacterial infections. Good hygiene is especially crucial for protecting individuals with weakened immune systems who may become infected more easily, says Matt Ashton, Director of Public Health for Liverpool. One way to prevent germs from spreading is to wash your hands properly after using the bathroom. Ashton explains, this is particularly important if you are visiting vulnerable relatives in hospitals and care homes. It's also a good idea to carry around hand sanitizer to use as soon as possible after interacting with a self-checkout. This can stop bacteria from spreading, although hand washing with soap and water is always ideal, according to Healthline. The Centers for Disease Control and Prevention reports that hand sanitizer does not kill every germ and may not be as effective on hands that are visibly dirty or greasy. Luckily, the CDC provides a step-by-step guide on how to wash your hands the proper way. Before you grab some soap, make sure your hands are wet with clean water that's either warm or cold. Afterward, you can lather your hands with a soap, making sure to scrub the backs of your hands between your fingers and underneath your fingernails for at least 20 seconds. Finally, use a clean towel or air dryer to dry your hands after rinsing.
Did you wash your hands with soap? Did you dry them?